You know how this goes. All right, we are live. We are live. Good afternoon, everyone. Good afternoon. Thank you so much for joining my Sound Off Saturdays. I really appreciate all the people who reach out to me and ask me to keep doing this because I am not famous, but I enjoy talking, and this is an extrovert's life, right? I got microphones, I got lights, I got friends that like to talk, so I'm so appreciative of everyone that joins. And today, if you've never seen before, on third Saturdays, I do a Leading Ladies series. And I just started that in August, and we started off with Ladies in Ministry. And thank you all so much for participating with that session, that webinar. It was completely awesome. Today, we're continuing that. It's the third Saturday in September, and we are doing Leading Ladies in Healthcare. So I'm going to introduce these ladies in a very, very small way, but I will let them introduce themselves when they get ready to answer the first question, okay? All right, so first of all, I'm going to start with Miss Shantay Page. Shantay and I went to high school together, Oak Park, and we were also on the pom-pom team together. Oh, my goodness. We had some fun back then. Shantay is a fabulous person. I have watched her grow on social media. She's a mother. She's a wife. She has a very athletic son. She has a son that is doing an awesome job in fashion. And she is also a nurse, a NICU nurse. Is that right?
Yep, I work in the NICU.
So very active for her to share her perspective with you all regarding some of our questions today. And then we have Grace Sobers, who is also a nurse. Grace is one of my best friends of over 25 years. If anyone knows me, you probably know her or at least have heard of her. And Grace is also a mother, a wife. She has 3 awesome children, and she is just thriving. She's also my Eastern Star sister. We were initiated together, and we were initiated together into Alpha Kappa Alpha Sorority Incorporated. Talk about being best friends all over the place.
It's full circle.
Absolutely crazy. And we went to the Howard University in Washington, D.C. a few years apart, but we both matriculated and graduated from there. And I am so thankful that both of these ladies accepted the invitation today. And I sincerely appreciate it. So let's go ahead and get started. All right. Question 1. I want to start with Shantay. Okay. If you could just tell us what's your role, and I know I introduced it, but you could talk a little bit more about it. And how did you know kind of that you were kind of called to this field or this industry?
Okay, perfect. Yep. So I'm a NICU nurse. I work at a large children's hospital in the Metro Detroit area. I work in a level 4+ NICU. So we take care of very, very sick babies, babies that need transplants or heart-lung bypass, babies that need any kind of surgery, that are born with genetic problems. So all sorts of things. So that's just, that was kind of like how I started my nursing career. And that's like I call that like my main job, you know? And so that's kind of, where I get paid from every other week. So that's that. My other thing that I do that is kind of more like my passion and my heart is I teach nursing school. And so I teach pediatric nursing for 2 different universities here in Michigan. And that's kind of like my passion, my heart. That's what I kind of always knew when I was in nursing school that eventually I wanted to do later on down the line. And kind of the opportunity fell upon me way sooner than I ever anticipated. I definitely thought it was something I would do after my kids are graduated from high school, maybe even college. And it was just kind of like my chill job, And the opportunity came about, and I love it so much. I really love teaching. I really love helping and molding our new nurses and, kind of helping them build that foundation and stuff like that. So that's also a little something I do. I also have like a bunch of little side jobs too,
Of
but
course.
lots of those things.
Right.
But those are kind of like my two main things. I was one of those people who like always knew growing up that I wanted to be a nurse. And then I think that it was me having my first son, who I had him really young when I was 19, and he was a preemie. He was a 33 weeker, and he spent some time in the NICU. And I think that confirmed that I wanted to be a NICU nurse. And I'm kind of one of those people that everything I do, I got to be the best at it. I have to do the most. So I knew that I didn't want to just be a NICU nurse in like one of those hospitals where it's just like feeders and growers and the babies aren't really that sick. I wanted to be a nurse at the best NICU in the area to take care of the sickest kid, and I was going to save some lives. And so that's kind of what landed me in the job that I am now. And I absolutely love it. It'll be the place that I retire from for sure. But I absolutely do love teaching too. And that's kind of like my fun.
Cool. And that it shows all over you, all of your posts and the things that you talk about. It definitely shows that you are very, very passionate about this. And you and Grace have some teaching in common. So I'm going to give the same question to Grace. What is your role specifically? And of course, how do you know that this is your passion, something that you were called to also?
Okay. Well, first, Jamila, I just want to thank you for this opportunity. Like, this is awesome. It's great to see what you're doing, and I'm just happy to be a part of it. I too can relate to Shantay. Well, just to tell you a little bit about my current role, I currently am the perinatology nurse practitioner for Kaiser Permanente, Georgia. I oversee the coordination of high-risk OB care for about 7 clinics in the Georgia region. And I also oversee their, I would call it a robust program of remote monitoring for hypertension and diabetes here in the Georgia region. And I'm sure we'll kind of get into the depths of why that is so important to me. I don't have, when I was reflecting on this, I don't have like a specific like time in my life that I can say, boom, I knew I wanted to be a nurse. I always knew I wanted to work in healthcare. When I was a little girl, I used to tell my grandmother, I want to be a doctor. I want to be a pediatrician, all of these things. But I feel like it's almost like alchemy. I kind of feel like my entire life, I have these like little pearls, no pun intended, that have happened throughout my life that have created this string of life experiences that landed me in my passion. And I too am an adrenaline junkie. I show up for the crisis. I did not want to be just no flight to bedside nurses across America or across the world. I didn't want to be, the nurse that's like, whoa, 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 oh, you're well, let's get you. No, bring me half dead. I need that. So I enjoy high-risk OB. I started out my career once I left Howard University. I started working at Howard University Hospital in OB. I moved to Atlanta and I left OB and went into critical care. So I did like neuro ICU, but I realized patients don't talk to me in neuro ICU, and I'm a talker. I couldn't talk to my patients. They're all on vents, and it was just really like, oh God, I don't know if this is for me. So I ended up transitioning back to OB, and as I was working in OB, I worked in labor and delivery for about maybe about 8 years or so before I decided to go back for my master's. I just was like not okay with the very unacceptable outcomes that we had for our patient population. And Shantay, I'm sure you can speak to, you get to see some of the, aftermath of what we deal with in high-risk OB, because we work very closely together. And so with that being said, that's my role. I'm excited. I have moved into an area of quality improvement. So I still do direct patient care, but I have a hand in quality improvement because I feel like being a change agent, I can reach the masses. I too have experience in teaching. I've taught for 2 different universities here in Georgia. I love it. I absolutely love it. It's life. It's like, oh my God, like I'm breathing. Ain't nothing. Like nothing is more important when you're in that moment. So I see you smile when you talk about it, and I'm like, I feel that too. I get it.
Absolutely.
I mean,
Cool.
I can
Sorry, I keep on looking down at my phone because my phone is so StreamYard, just so you know today, StreamYard is having a little issue, but it's not on the end of the viewers, it's on my end. So in order for me to see any comments, I have to look at my actual live feed on my phone versus looking on the screen. So it's messing me up today. But anyway, I'm just going to keep on going because we're live and it's all good. So I'm just going to keep rolling. Okay, so my second question, I'm going to go to Grace. What are some challenges that you face? It could be as a Black woman or it could just be as a woman kind of leading in healthcare. And that's a wide open question.
Yeah, that was a hard one. Because we oh God. Okay, so I'm gonna speak about two. One is professional, one's personal. The professional challenge that I seem to face more often than not is lack of representation in leadership and mentorship. Because I mean, it's no surprise to all of us that, especially in nursing, we have very robust staffs that are full of minority women. Especially in women's services, like that's not uncommon. But as far to be able to have leadership at that executive level, we don't have a lot of representation when it comes to minorities. I want to say it's probably like there's a couple of studies that kind of speak to like over 75% of faculty members in, it was a Chronicle of Higher Education talks about how like over 75% of faculty in higher education, in medicine and nursing is 75% white. So, and then 5% is Black and even less than, have Hispanic. So that kind of gives you like a snapshot of what we see, Right. That is a challenge because when you're seeking to be the epitome of excellence when it comes to your field, speaking to somebody that's at that level is so critical. Yeah. So that has been a challenge for me. But I will say that I've had to be very intentional about seeking out role models, seeking out people that are going to help me navigate this industry. They have not always been minorities. I will say that I've been afforded two great opportunities. I worked at Grady Memorial Hospital, which is one of the largest perinatal regional centers in the South Atlantic region here in Georgia. And the CEO of the hospital is a Black woman from Compton. Shout out to Jacqueline Hurd. Amazing nurse leader. And it was really cool because like I felt like a little kid when I started working at her. The chief nursing officer is Black. Like I could not believe it. But she was very good about teaching the fundamentals of leadership. She didn't just do that, save that type of, information and education for people that are at the executive level. Right. She was teaching executive leadership skills to the staff nurses, to the clinical nurse managers, to the charge nurses, to everybody that was involved in what it is that we do. And that was really, really important and critical to my success there at that organization. And I transitioned over to Kaiser, who in response to the poor maternal morbidity and mortality rate in Georgia, they're very progressive. So they decided to start a program that basically directly attack that issue in our region. And so a lot of the leadership in that program are Black as well, including myself. So that has been a barrier or somewhat of a challenge for me, but I'm seeming to kind of navigate it the best way I can. The personal challenge that I would say that I deal with is balance. Balancing being a mom, first of all, being good to me, you know what I mean? Because as a caregiver, you are constantly pouring over, you're just pouring out all the time, even the crud, you don't have nothing left, you're pouring. But being able to balance being good to me, mind, body, and spirit, being of service to my husband, my family, my children, and being able to go out and give my best to the patients that I encounter, and then coming home and doing it all over again. So balance has probably been one of the most significant challenges that I've dealt with. I don't look like what I've been through. I suffer well. And, that I was just being transparent. Those are the two things that kind of stuck out the most to me.
Yeah, good. Shantay, same question.
Yeah, I mean, all of that, like ditto times 10. Definitely in professional people, like she said, people that look like me. The unit that I work on, there's 175 nurses, I think, in the NICU that I work in, and I think there's 11 of us that are Black. And it is a very challenging area to work in. It's really hard. You need to be very, very, very smart. And I'm just trying to get more for me, because at first I thought it was we just aren't hiring people that look like me. And then I started kind of early on in my nursing career sitting on the interview panels and stuff, and realizing that we just aren't even applying for these jobs. And it's something that I talk about with my Black peers that I work with all the time, is that, I don't know that if just even in the whole organization that I work in, not just the hospital, but the whole Detroit Medical Center organization, just a lot of Black women are not going to apply for these very high, intense, critical areas. And that is a struggle for me, because 95% of the population in which we serve at the DMC are Black. And so for a mom, a Black mom, a young Black mom, to have a baby that is critically ill enough to be in my NICU and not have that many nurses that look like her is very, very challenging for me. And that was really hard. So that's like my bedside nursing standpoint. As far as faculty, working as faculty at two major universities, there are one of them is a Catholic university. There are no Black faculty, like at all. And not only am I the Black faculty, I am the loud Black girl with purple and blue hair. And I'm faculty. Like, what is going on? And these nuns at these penance ceremonies just sitting there looking at me as I'm being asked to pen 10, 15, 20 students a semester that are personally asking me to pen them. And I'm coming up in there with my purple and blue hair. And these nuns are like, where did y'all find her? You know? But I've done some amazing things at both of the universities that I work at, and one of them I'm leading the whole clinical aspect, and so that is like it's challenging, but I love it, because I want them to see, mostly white students, I want them to see that there are strong Black people out here who can lead and do great things, and who are smart and can have these deep intellectual conversations with you on a level that just blows your mind. And so I feel like that kind of helps to change their mind. I feel like I've encountered quite a few students who have probably given me this, like, who does this woman think she is type of look. And then after they complete their semester with me, and they're like, wow, like, this woman has changed my life. You know what I'm saying? And so I think that that has been good, but challenging, but good. And personally, yeah, like Grace said, the balance. I have no balance. Anyone who knows me can tell you I have zero balance in my life. I am 100% nurse. I'm 100% mom. I'm 100% wife. I pour everything into my job, my kids, my husband. I pour zero into myself, like zero. I get my hair done. I'm asleep half the time that I get my hair done every week. Like, that's the only thing I do. But it is very challenging, and I think that that's so challenging for nurses, because it's not just one of those jobs that just, it is your whole being. It is your whole soul. If you are a nurse, everything about you, whether you are at work or not, is a nurse. And that's just one of those careers that just kind of, unfortunately, sometimes it's just like that, like you just can't ever let it go. And so it does make it very challenging to have that kind of balance, for sure.
I definitely can see that. I think we were just talking about last week, Grace was talking about an accident that she encountered and driving. And I'm thinking, oh God, every time nurses see anything, they're probably always on this mode of, oh my God,
Yes.
are you okay while you're having your own crisis over here? You're trying to see about this over here at the same time. So kudos to you all. I have a sister-in-law that's a nurse. The godmother of my children is a nurse. I have nurses everywhere in and around, doctor friends, and it's not for the faint at heart. That's all I have to say. You all do an amazing job, but I am glad that there are people like you all that are doing it that have a passion for it. I think we know people in all aspects, in all careers that are serving in roles that they really aren't passionate about or don't really care about, so they're not really giving their best. But this is a field where we really can't afford for people to be kind of mediocre at best or not really wanting to do it. You're talking about people's lives. You're talking about babies, Shantay, who are on the brink of dying, and you can't afford that. So kudos to you all. Let's go with, I'm gonna go Shantay this time. So what is one misconception, maybe specific to your field, just specific maybe to the NICU or specific to even, it could be specific to your position as well, but one common misconception that may be out there?
Well, I think one common misconception, I'll give you one to NICU specifically, but one to just nursing, is that we make really good money. I mean, girl. I mean, we do. I mean, I can afford myself and my kids and my family. We have a great lifestyle. However, I do not get paid nearly enough for the stuff I have to deal with. So I think that there are lots of people who say, I want to be a nurse. It's a good job. They make good money. You'll always have a job. And then they go into it and be like,
what is right?
Like, no, you do not. So if that is your reasoning for wanting to go into it, because you'll always have a job and because you make good money, don't do it, because it's not. You have to be one of those people that I would do this for free because I love it and so passionate about it. You know what I'm saying?
Yeah.
I think for NICU specifically, I think that I think when you tell people you're a NICU nurse, if they don't know any better, they really think that all you do is feed and rock babies and some little preemies that's just growing and not, like you said, on the brink of death. I think that's really what they think that I do. I also think a lot of the nurses who I just talked to a good handful of brand new grads that have just started working on my unit within the last 6 months of the year. I think that is their conception as well, that at my hospital in where I work, that's what they do. And then they come there and they see that we have babies that die and babies that are very, 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 very sick. And you're always having to have that conversation with the parents every day, that today might be the day. I think that they are kind of taken aback, this is not what I signed up for. And so I always tell nurses, even new grads or in nursing school, kind of go shadow that area that you think you might want to work in, because it might be all glorified that this is what you want to do, and then you get there and realize it's kind of not what you expected. So I think that those would be the two misconceptions.
That makes a lot of sense. And to make sure you're not using any TV as your guide as to where you want to work in the hospital, because it will get to the TV question in a minute. But anyway, Grace, give me a misconception. And I just want to give a shout out to, thank you to everyone. I'm looking at your comments on the phone. And I see that lots of people are making really good comments, that you guys are awesome. This is very good. Nurses get lost in serving everywhere. So I see some really great comments. So people are really engaged. Just wanted to let you know. All right, Grace, your turn.
I'm going to go, I'm going to piggyback just a little bit on what Shantay said.
We are vibing, girl. We are vibing.
I think that people think labor and delivery and obstetrics is like balloons and roses. It is nothing. I'm sorry. In some communities, it may be. Where I work, it is not. And so, I don't know. Like, I think that it's so funny. She made the comment about the new grad. When I was working as a clinical nurse educator at Grady, I remember, all the new grads, they come in, they're so excited. They got their fresh scrubs on. They're like ready, first day. And they're like, I can't wait. I just want to catch a baby. Well, actually, you're going to be learning how to take care of this lady who is a GSW, gunshot wound to the stomach. And we actually had to do a stat C-section. She's ventilated in your postpartum. You're like doing her postpartum recovery. They're like, what? Like, that is that is not what I expected. Or you have this 25-weeker who has a history of chronic, renal failure, and she's on dialysis 2 to 3 days a week, and she's back up in the ICU, and you got to go take care of her. So no, it's not like that all the time. Or you have the patients that it was completely fine. I don't know what happened. The patient got extremely sick. I'm pushing drips. This lady's on this, she's on that. Like it's not like that. And remember, I said in the beginning, like, I'm an adrenaline junkie. I hated getting floated. I don't know if Shantay, if you've ever gotten floated to the newborn nursery, if y'all census is low, has that ever happened to you?
No, because our hospital is a referral base only, so we don't birth babies at our hospital. It's all referral based. So I don't.
Because that is a nightmare for those of you who don't understand that. If you are like one of those people that's like high pace, I go in and I do it, I'm the saver, and they go, oh, our census is low, we're going to send you to antepartum, or we're going to send you to like a routine postpartum unit where you're just helping people, change diapers, and or you're passing milks and ice. Like, I'm like, it's gonna be a long night. Just send me home, I think that the misconception is that it's always that. It is not. Yeah. As the general population gets sicker, and we know we are dealing with significant socioeconomic things that affect healthcare, that affect education, that affect, have this ricocheting effect on all of these things. Right. As our general population gets sicker, so do our patients. Our patients are being diagnosed with diabetes, hypertension, all of these different things earlier. I mean, I have patients that are 21 years old, chronic hypertensive on 2 agents, pregnant with twins. I'm like, like what are we doing? Like, it's a lot. And in addition to that, something that I don't know if you have heard about it, but there's a weathering phenomenon that Black women experience. If you listen to the literature or whatever, like, there's a weathering phenomenon as it relates to chronic stress that Black women experience more so than our counterparts, which means that some of the comorbidities that we experience as young Black women, we're more inclined to experience those things that contribute to that, as it relates to that chronic stress piece. So listen, I think, like I said, they think that it's balloons and roses. We're trying to prevent you from pushing roses from the other side. It's a very different, aspect. It can be fun. It's very rewarding. But I'm just thankful to be a part of it, because like I said, my life story, I could do a whole session on it, where these things line up. Our life experiences really do prepare us to walk into this arena every single day.
Yeah,
absolutely.
That makes sense. And I think both of you may have touched on this next question already in a previous question. This one was, what are some barriers to women leading in this field? I think you both kind of touched on that, but if you just want to say something a little bit more specific, you can. I do remember hearing something, but so what are, Grace, I'll go back to you. What is a barrier or some barriers to women leading in this field? Like I heard Shantay say that a lot of Black women are not applying, which is a barrier in and of itself. And I'm wondering, even when you say that, like, I wonder what makes some of us not apply. Is it intimidation? Is, what other thing could be a barrier even to the application process or getting to that point?
Yeah, you really hit it on the head there, because something that you will notice in healthcare, and I don't want to make a blanket statement, but I've worked a lot of places, so when you go to critical care areas, ER, OR, ICU, NICU, labor and delivery, predominantly it's not a lot of Black representation in those areas. It's not. And one of the things that Shantay pointed out was the reason why is because, like, it's not for the weak at heart. It's not like when I said you're taking care of critical patients, it's not like intuitive stuff that you're learning when you take care of these patients. And keep in mind, when you finish nursing school, you are a nursing generalist. You know, vitals,
right?
You know, the principles of assessment, but you have to learn and you know how to prepare for the NCLEX. The real work begins when you actually get a job and we say, okay, yeah, that's nice that you learned how to place that stethoscope, but I really need for you to get your nursing guts. I need you to be able to walk into the room and feel like, oh, something's not right. You know what I mean? I need you to be able to ask questions, be resourceful, be an advocate, speak up. Like those are things that people need to be able to do. And one of the barriers for, I would say, as a Black woman would be to be taken seriously. Because when I stepped to the table, like I graduated from Howard University. So I'm like, oh, I went to Howard. But even if I didn't go to Howard, if I went to, you know, WC3 or I went to, those nurses are just as good. You know, Howard afforded me. Howard didn't give me the nursing degree that prepared me for the nurse that I am today. It didn't do that. Let's be real. Howard gave me the life experience that I needed to be a change agent in this world. That's what it did. But the nursing degree, I could have got that from community college. I didn't need, you know what I mean? But with that being said, a barrier would be when I step into the table and I sit down and I talk to my counterparts and I'm saying, you know, if I advocate for a patient, it's like, oh, she don't know what she's talking about. Oh, she can't be as smart. And the perception is that you're not as smart or you're not as, you know, professional or you're not, you know what I mean? Like you're not as refined as everybody else. So you really do have to learn how to talk that talk and walk that walk. And when they start to see it, one of the benefits of, you know, going through, and I'm sure Shantay has experienced, especially in academia, when they start, I love for people to second guess me. I love to step in a room and like, you know, like chilling and giving them that. And then when we start to talking and I come up and I say, well, do you, and they looking like, oh my God, like, what is, you know, I love that. Please underestimate me because I'm here to tell you that you look at me and you're impressed by me. You're like, oh, she's really smart. She speaks very well. I know y'all don't deal with that in Detroit and Virginia. It's like, I'm just joking. You speak well. I can't, you know, get you to understand how many times I've heard, oh, you speak well. Oh, wow. Like, what did you expect me, you know, to do? But anyways, with that being said, when they do that, it's an opportunity for us as educated Black women to say, you see that girl, that teenage girl that has preeclampsia and that 29-weeker that's about to deliver because you thought that she didn't do what she's supposed to do and she didn't come to her prenatal visits because she just didn't care. She had a whole bunch of other stuff that was going on with her that you didn't know about. Yes. I am that girl. I am that teenage mom. I am that babe mom with a baby out of wedlock. I am that mom that came from a broken home that didn't, you know what I mean? I am that girl that's pregnant, that's eating flaming hot Cheetos and grape soda and really not really thinking about what this, you know, what it's doing to my body. I'm that girl. So because you're impressed with me, thank you for being impressed. But I need you to understand that those women are capable of being just as fierce as I am if given the right opportunities, the right information, is educated, is empowered. That's what we are supposed to do. So that's a barrier, but I look at that as motivation because I'm like, please think I'm stupid. I really want you to. So I get a kick out of it. So
we already know. Shantay, same question. What is a I'm sure there are more than one barrier. But you know, what is a barrier that comes to the forefront of your mind when you think about ladies in your field and in your position or your role? What is a barrier you can share with us?
Yeah, I think we talked about it earlier. I know Grace mentioned it. King James. I'm sorry, my dog is acting crazy.
That's okay.
I think that she touched on it earlier by like not having those role models and that representation and that people that look like you. And, you know, when I say, you know, about people not even applying, you know, maybe they don't feel like they can do it or they're strong enough to do it or strong enough to work in that area and field because they don't see people that look like them. You know what I'm saying? If they're like, if all these ICUs, ER, OR, labor and delivery, NICU, all of these specialty, very critical specialty areas, you don't see when you go through your clinical rotation, whether it be in nursing school or whatever, just knowing nurses, and you don't see women that look like you in those areas, then maybe that's also going to deter you from wanting to go to an area like that, because you don't see that kind of representation in those role models that tell you, girl, you can do it. You can work in that area. You can be just as smart. You can do all of those things. And so I think for me, that's like the biggest challenge, and just really not even certain or sure how to be able to get that information out there to nurses, whether they're new grads or experienced nurses, that like, come to these critical areas, come and get this experience. And it's going to be hard work, but you can do it, and you can do well in these specialty areas.
Right. Yeah. Go ahead, Grace.
I wanted to say something else too. It's critical to have representation too, Shantay, because we're more inclined to take a chance on somebody that may not be that straight A student. Or that student, when you're looking at their stuff and they're like, oh, they got a C in med surg. Well, tell me a story. You know, like looking at C in med surg doesn't mean anything to me. We really have an ability to kind of hone in on like people that you're like, I'm gonna take a chance on her. It's something about this nurse that I think that's what it takes, and it's not necessarily what's on the paper. And so that representation thing is important.
Yeah, I mean,
Absolutely.
representation, I mean, even just me as a teacher, you know, I look at children that I teach, children that I work with, and we say this all the time, that representation matters. When people, whether it be a kid, whether it be a teenager, a 20-year-old, when someone is looking to do something, to go somewhere in life, and they are looking up or looking out and they don't see anyone that looks like them, that can be, it can be a struggle for some people. Some people may look at it as a challenge to say, I'm going to be the first, or I'll be but for other people, they need more assurance and they need more confidence to say, okay, look, Miss Page is doing this, maybe I can do that. You know, Miss Sobers is doing this, maybe I can do that. Miss Galt is up here teaching these kind of kids, maybe I can do that. Like, that is really important. And one of the things, okay, of course I'm gonna plug HBCU at this point, but one of the things that HBCUs has afforded a lot of our students is that kind of personal, you know, hey, your grades may not have been this, but come on over here and let's see what we can do with you. You know, your SAT, ACT scores, which we know at different times doesn't mean anything anyway, may not have been this, but look at what you can do. And then you turn around and you look at some of the best people we have in medical fields and engineering fields are kids who were not the best students for whatever reason. Something could have been going on with their life, or they just didn't have the motivation, but somebody took a chance on them, they pushed them, you know, and the whole relatable aspect, like you being able to relate to them and say, hey, listen, I've been down the same path, I've been through the same thing, but look at where I am, and you can, you know, you can be there too. So I think that that's really important. And it leads right into the next question. And Grace, we talked about this was something that you did at Clark Atlanta not too long ago, but you know, how do we engage, how do we inform like our young people on proactive healthcare? And you know, what are some avenues that maybe the two of you have used to try to get, because there is a big misconception that a lot of Black people don't go to the doctor because we just don't want to go to the doctor. I mean, let's be frank. Or, you know, we don't want to go to the dentist because we don't want to. Now, there's a lot of truth in that. I mean, you know, the dental world needs to work on those tools so that those tools don't sound so loud, because we already know that gets people anxious, right? In that office, you hear that,
it's a wrap.
Already lost some people, right?
For me.
It's over. And we know that there are some people that just don't want to go to the doctor. I get that. But we also know that there are more things than just people making a conscious decision saying, I don't want to go to the doctor. I don't want to take care of my body. I don't want to take care of this baby I'm getting ready to give birth to. There's so many other factors. So what, you know, I'm going to go with Shantay first. You know, how do we get our young people really engaged in proactive healthcare? And is there something you've done or maybe DMC has done, by way of like pulling our young people in, saying, hey, this is what we have to do to take care of ourselves, so to speak?
Yeah. I think from my experience, a lot of times once they've reached me, right? Once they've reached the point of having this baby and getting to me and having been proactive, whether it's not getting prenatal care or, doing drugs during their pregnancy or whatever it is, once they got to me, I feel like it's a lot of like damage control that I'm trying to do, right? Yeah. So they didn't get prenatal care. They didn't do these things they should have done. They didn't eat right. They didn't take their meds. They didn't do all these things when they had the baby. And now the baby's here. Now the baby has all these problems. And for me, I think that it is just like trying to get them all the resources possible to be able to care for this baby who may need long-term care, who may need meds going home, who may need all of these things. And even though they weren't proactive with themselves, like how can we be proactive in making sure that this baby is able to have like the best chance possible in whatever that life may look like. Right. And so I think for us, because the DMC is in the middle of the city in a poverty-stricken area, making sure that they have as many resources as possible. And pre-COVID, that was like 100%. I thought that we did the best with that. I thought that when you compared us to the only equal in the state of Michigan that's like us, that would be U of M's Children's Hospital, who serve more middle class people. I thought that we were top notch, the best in all those resources. I have noticed lately, and I even talked about this at work a couple of nights ago, that just like since COVID, I feel like we don't have as many people and programs giving to us and doing all these things. And so those resources that I used to just be able to pull from a plethora of things, I don't have that anymore for that 16-year-old mom who's about to take this baby home and she doesn't have a bassinet or a playpen. She doesn't have a breast pump. And we provide every mom that has a baby in our NICU with a breast pump. So they've been pumping this whole time, but now she's about to take this baby home and she doesn't have this $400 Medela breast pump that she's been using for the last 6 months every day at the hospital, Right. And so before it was just like, I'm just about to go to a storage closet and get her a breast pump and give it to her, not loan it to her, not let her borrow it, but give it to her. I'm about to just go pull this playpen or this bassinet or this high chair or whatever they need. All these supplies, the baby's going home with a trach, and I know the insurance only supplies them with so many suctions that they got to wash out and stuff like that. I'm just about to just go grab some, like it's not a big deal. And I'm realizing that that's not so easy for me to do anymore. And I know that with COVID, there has been lots of budget cuts with a lot of things. And so just for me, just trying to figure out a way with the last 6-7 months has changed all of our lives, trying to figure out a way to be able to still get them those same resources and those things that they need so that they can be able to be proactive in their babies, care and stuff. Move, once they do leave the hospital. And that this is very new for me. It's a new experience for me because that hasn't been the case before. So I'm not really sure what I can do to help now because it's just kind of been very new and just learning how to navigate this situation of not having as many resources as I always had for them before, because now I'm sending these moms home without the things that I feel like they need and will help them be successful.
Right. And then even for, my husband and I pastor a church. So even when you're talking about like people with giving, we have this challenge now with COVID where, people are not accepting a lot of things either right now, of course, due to the nature of what's going on. So you have people that may want to give bassinets and give coats and different things, but the exchange of things is really, really difficult right now because people are not trusting of things, of course, and they don't want to sanitize and, and different things like that. So that does make it really difficult and challenging right now at this specific time. Grace, same question. How do we make sure our young people are actively taking care of themselves, regularly getting checkups, pregnant or not, but definitely if they're pregnant. And then is there something like you've done or you've participated in, with our young people in regards to like their health care?
Absolutely. The biggest thing that I think that would be benefit or is beneficial in engaging young people is telling the story. Sharing the stories that, your story, experiences that you've experienced, because mainly young people want to see, how is this relevant to me? And so I find that it's been very beneficial and when I say get down to their level, like, I mean, like, just in their space and say, I understand you, I see you. One of the things that I do or have done to engage young people is that I've been a guest speaker at one of our local HBCUs at Clark Atlanta University. Was an amazing experience. I was super nervous doing it. I'm like, I don't know if I can do this, but I totally enjoyed it. I actually took them, and I think I'm going to take this show on the road. It is actually a virtual Well Women's Visit. What to expect at your virtual Well Women's Visit. Yeah. And the amount of young women, we had about 50 or 60 girls that came. And when they came, like, I was like, wow, like you think because you do this every day that everybody knows it. But then you realize, wow, I didn't realize that people didn't know that, like, common things. So like social media, doing things through social media is important to engage, but telling stories are critical. And I'm gonna tell you why. Perfect example. The recent passing of Chadwick Boseman, right? You have him pass from colon cancer. I think it was colon cancer. And it became a thing for young people to discuss colorectal health.
Right.
Go figure. Nobody talks about that. Right. In our community, we don't really talk about that type of stuff. We keep that kind of hush hush. What I love about this generation is they are not silent about anything. And I absolutely love it. And that's going to be a big thing for them. They have the ability to make changes and make headway that we didn't have a chance to do, and our parents didn't do, or couldn't do at the time. But telling them those stories are important because they don't have a frame of reference. But if they relate to you, then they do. Right. So you have Chadwick Boseman that now people are relating to colorectal cancer because he's young. He looks like me. Like, what do you mean? He went to Howard. He's funny. I'm not funny. He's talented. He's like all of these things that look like, well, why would this happen to him? Well, it doesn't have to look like it doesn't have to look bad. It could happen to anybody. The sharing in terms of maternal mortality and morbidity, Beyonce Knowles and Knowles Carter, I'm sorry, and Serena Williams sharing their experience with preeclampsia. Like right there, that tells you, like, them sharing that story to young people gave young people to go, oh my God, really? Black women are dying? And because of that, I have more young people walk into my office and they're able to say, so I know that I'm supposed to be watching for like this thing called like preeclampsia. Like, I read this in a magazine somewhere. Is that good? And they're more intrigued. You have this conscious consumer, this patient that comes in and they can advocate for themselves because they got a story to draw from. Right. And even more personal when I'm dealing with young people, especially when they're really, really young, like they're 16, 17, maybe they're thinking about becoming sexually active or they're trying to make some decisions about their bodies. I use that as an opportunity to connect. And the reason why I use that is because they don't necessarily want to connect with their mom, sometimes depending on that relationship or whatever, they don't want to share that. But I use it to tell them, hey, I was 17 years old before. And quiet as it's kept, I kind of suffer for some of the same things that and I may spit out something that sounds familiar and you'll see like a light, like, oh gosh, she knows. Yeah. Yes, I know. I've been there. Don't let the smooth taste and the wonderful letters behind my name fool you. Right. But connecting with them, they're like, wow, like, it's so important to tell those stories. Stories make it real. Stories give them hope. Stories tell them of the possibilities. So how do we connect with them? Social media, use their platforms. Right. Learn how to do social media. You got to do it. And when you're with them, don't be afraid I think that's one of the reasons why maybe we didn't connect necessarily with our parents the same way. Because some stuff they just didn't tell us until they were older. You like, Mom, you could have told me that. Like,
Right.
Yeah.
So now I have a 15-year-old, and the conversations that we have, I'll be like, oh boy.
Yeah.
But I'm thankful because she's talking. And she knows, like, when now there's some stuff I'm not giving up. I'm just taking it to the grave. But like, I may ask for a friend.
Right.
A story about a friend.
Right.
Telling those stories to show them that you have been there. You're flawed. You're not this, perfectly well polished, poised person that's, always done it the right way. Now they need to see, you look at that throughout pop culture. Like people look at Jay-Z being a billionaire and he used to sell dope.
Yeah.
You know what I mean? Don't minimize his ability to reach those boys that are like my mom, my dad's in jail, my dad's dead, my mom was dead, my sister was dead. But look, concrete roses, like, come on, let's pay attention to that. Like, that's important.
Yeah.
And I like looking at, Shantay being that NICU nurse and being knowledgeable and teaching nurses. Like I too have gotten that, Miss Silver, can I talk to you and ask you, like, what did you do to become what you are? And I don't think it's a big deal, but they do. They think it's a big deal. So sharing your stories is critical.
Yeah, that's why it's important too. Before we do our final question, you hear a lot of people always kind of downing celebrities for speaking up and speaking out about different things, but we realize that these people are influencers. When hearing Serena Williams talk about her near-death experience with her baby, hearing Gabrielle Union talk about endometriosis and adenomyosis, people didn't even know what those terms were before they came out of her mouth, so it's important that we realize, first of all, that celebrities are people. I know celebrity means something specific, but they're people like you and I. They might not have the same problems all the time, but certainly there are some things that follow all of us, regardless of what our bank account says. And that's very obvious when we saw some of the things that a lot of them went through in their pregnancy journey. Those were very shocking things to hear coming out of their mouth. Watching Candy Burris on The Real Housewives of Atlanta go through her surrogacy. These things that we may not be having the conversations had that not aired. Had that not happened. So I see Tamika here saying she has a question. Tamika, what is your question? This is not Q&A going on here. But anyway, thank you for sharing that, because it is very important, and relationships change over time. So moms and daughters evolve into different things over time. Dads and sons, dads and daughters. It all hopefully gets better, and we become more open. And more engaging and more willing to talk about some things that maybe were taboo before. And then sometimes we know that it happens that way because our moms and their moms didn't really talk. So they opened the door just a little bit more, and next one opened the door a little more. You get more and more comfortable, over time. So hopefully by the time I get to the teenage life, which is not that far away, the twins will be 12 in December. I've already had some conversations, but I'm sure I'll be having many more intense, and I'll be calling on anybody I can call on to assist those questions. So get ready for that. My final question is, this is just a fun question for everybody that's watching on Facebook. Just something really fun. Oh, wait, I did want to say one more thing. I almost forgot about this. I put up a question on Facebook in a group that I'm in, and Grace knows about this because I asked her specifically about this, and this was surrounding the HPV vaccine. And because the twins are in middle school now, it's been brought back to the forefront of my mind because their doctor brought it up years and years ago, just as something that was kind of coming down the pipeline, and I didn't realize that people were getting this vaccine at middle school, I was just really just unaware. And so that's another thing that kind of came about in a conversation, but to see the differences in knowledge when I put that question up in that group of just what people thought about it. And a lot of people have gotten this, some people were apprehensive, but it generated a discussion. This one lady said, this has generated one of the best discussions I've ever had about this. It's helped answer so many questions, and it helped put so many things in perspective. And at the end of the day, it's your decision, when you're going to do it. But it also brought up a lot of new points that we don't think about, things that are plaguing younger people now, and specifically some of the cancers I get, related to HPV. And that's just it's a whole world that I was just opened up to in a second. I didn't even have a moment I was thinking about it, and then it crept up on me, and I was like, these girls are 11. What are you talking about? Why are we talking about this? But it's obviously a conversation that I'm just joining, and I'm late in the game. So that's what I was going to bring up about that. Okay, so Tamika really does have a question. Can you talk about really quick, and I got one more, can you talk about the stigma attached to flu shots? Many Black people don't trust it. And in case you're wondering, I'm many Blacks. This is Tamika and Grace and I's line sister. Let me say this real quick about flu shots from my perspective, because I got one more question and then we got to go. So I've gotten flu shots sporadically. I haven't been consistent with getting flu shots. The very last flu shot I had was when I left the hospital after I gave birth to Trinity, because they would not let me leave without getting the flu shot. And I was just like, oh, okay, and I got it, whatever. And I got the flu a couple months after I got that shot. And so that was my experience. I know that doesn't happen to everybody. And it turned me away from wanting to get it, right? So I hadn't got it. Fast forward, I get the kids sporadically. I get their flu shots. We've done the flu miss, when they were really little. We've done a couple things. Well, fast forward to this year, January 25th, when I was knocked down to the ground with the flu. And I haven't had the flu shot since 2012. And I'm talking about, I was knocked down. It was right after my birthday, and I'll never forget it. And from that point on, I said, well, I think I might just have to start getting the flu shot again. And hence COVID, I kind of feel like I'm going to have to make a decision. I need to either consistently get this flu shot, and deal with COVID as it comes, or I'm just going to stick it out and hope that I don't get sick. But the way that I was sick in January, I just don't ever want to feel that again if I can do anything to prevent that. So I'm kind of the mind that I'm going to go back with getting it. So I'll let you go ahead and talk about it really quick, Shantay, and then Grace, and then we got one more question and we'll be done.
My answer's short. Get your flu shot, people.
Get your flu shot.
Get your flu shot. People.
All right, okay? Get your flu shot.
This is not so short. It is get your flu shot. However, I do think that community buy-in is important. And the reason why that's important is because the historical context of Black people and vaccinations, we to sit there and ignore that would be, you'd be silly to ignore it. So I think that it's critical for us to educate, number one, people, Black people, especially our people, on immunity building. That's good. Diet, healthy exercise, stress reduction and management, adequate rest. These are all things that honestly could prevent the flu better than a vaccination. I think arming yourself with knowledge is really, really important. Now, let's be honest. Yes, Tuskegee happened, amongst other things have happened. They have, that we can't ignore that. Right. However, we are conscious consumers. We have access to information that we didn't, and there are checks and balances in place. That are available to us, and it is our choice as to whether we choose to do it or not. As a healthcare provider for a major healthcare organization, my employment depends on me getting a flu shot. So my children, I'm like Jamila, I'm sporadic with the flu shots. Sometimes I get it, sometimes I don't, with them, but I'm the only one in my household that gets it every single year. I've never gotten sick. from it, but I can't tell you whether that's because I've never gotten sick from it or it's because I take cod liver oil in the wintertime. I can't tell you that. Arming yourself with knowledge is critical. And telling the patients like, no, the flu is, I'm sorry, it makes me cringe when I hear people say, I got the flu right after I got the flu shot.
Right.
That means that they're not aware that it is an inoculated virus. It's dead. It's a dead virus. It cannot make you sick. If you're sick, it's because you probably were already going to be sick. And you develop this stuffy nose as a because your body is building immunity, but it's truly not the flu.
Right.
It's not like MMR, measles, mumps, rubella, or any of those. It's not that virus that we have a patent on it. We know what the strands are. When we give you the vaccination and your body develops immunity to it, if it sees it, it's going to kill it. You cannot get it, right?
Right.
Flu vaccination is not like that. Flu vaccination evolves every year because strands evolve every year. So what we promise is not elimination of the flu. We promise that it will reduce the symptoms of the flu if you develop the flu. So I think that empowering people with that knowledge is important. Being, immunity support is really important. And read it in the pamphlet. Now the HPV vaccination, my daughter hasn't gotten it. The jury is still out, but I will tell you, as a woman who works in women's health, she's going to go ahead and get it this year. I just didn't want her to get it early, like 11. I'm like, I'm going to talk about sex. She's 11. Stop it. You know what I mean?
I was hesitant about my boys too.
Yeah.
So she's going to get it, but I kind of waited for that. Now, as far as the COVID vaccination, I'm sure it took Tamika. I know Tamika, so that might be on her. COVID, the jury it's too new. It's too new. I'm not putting nothing in my body that's not well studied. Go to the literature. Stay off the internet, like the news, for your information about vaccinations. Go to the CDC. Go to the World Health Organization. Go to those platforms to get your information, because sensationalized news, even in our community, which is sometimes fear-based, is not appropriate. You got to look at the literature, look at what's studied. So that's what I would tell you to do.
Thank you for that. That's really important. I think that people are thinking too, in light of a COVID vaccine coming, that some people who didn't get the flu shot before are considering at least getting the flu shot now and being more consistent, because maybe they aren't as trustworthy of the COVID vaccine with it being so new. So hopefully, Tamika, that answers your question. I'm going to get the flu shot, and I'm going to make sure everybody else does. Okay, this is the last and final question. We've gone over time just a little bit. Who is the most realistic TV character on a medical show to you? Thinking about your life in the NICU, your life in the hospital, who's the more realistic medical person on TV? I'm going with Shantay first. For you.
Okay, so for me, it's not a nurse, surprisingly, because I don't feel like I've really seen any real nurses on TV before personally. Mine would have to be Bailey from Grey's Anatomy, though, because that's me. Like that whole tell you how I feel, say it like it is, a little rough and aggressive with my way that I say it, walk real fast and you better keep up.
Yeah. I like that. Grace, what about you?
I struggle with this one. I'm an ER person, so Dr. Green was very realistic to me in terms of his compassion and his fight for what he did. I felt like that was the most realistic show, because they had good consultants. But in addition to that, like, he was just a real character. Yeah. And so I would say Dr. Green. Hawthorne, I started to say Hawthorne. Hawthorne is a really good depiction of what nurses are for real.
That's true.
I'm like, Jada Pinkett did that. Like, we will make lunches, clean stuff. We will sterilize some equipment. We will
forgot about that show.
And we'll be serving lunches to the homeless in the front of the hospital. So
it's not on anymore. Is that show?
No, I think it's like one or two seasons.
They only had short-lived, very short.
Yeah, it was short.
It
was because it was real. That's why, because it was real nursing. That's why it was short.
That's why
people didn't want that People wanted to see the rainbows and clouds.
That's what it is. That's what it is. My favorite person on a medical show of all time, and he may not be realistic, but is Dr. House. I absolutely love House. I miss that show. I am telling you that Hugh Laurie, he put all his whole being into that character. I don't know how he had any energy left for anything else. I love House, and I really do miss that show. So thank you guys so much. I really, really sincerely appreciate Shantay. I really appreciate you doing this. Grace, I really appreciate you doing this. I have so many people I could have chose for this because everybody that I know wears 4 and 5 different hats. I'm telling y'all, nobody does just one thing. You all do so many different things, but that's a good thing too, because that means I could use people for different webinars and I don't have to feel bad, somebody specific. But I appreciate you guys doing this. I'm just trying to use my little bitty platform to increase awareness about a variety of things, and I'm trying to showcase ladies that are leading. So many of us are leading in our 30s, our 40s, even some 20s. And don't necessarily have the platform to talk about things and to engage. In this manner. So that's all I'm trying to do in my little sound off Saturdays. And thank you to everybody that's been watching. You all have been great. Sorry I couldn't see you guys on the screen because it would have been perfect because I could have responded there. But shout out to StreamYard. If you all ever need to use anything for a webinar, StreamYard is so easy. It really does a great job compared to Zoom for this kind of format. Zoom does what it does for its format, but for this format, it's very easy. The setup is very simple. There are free accounts, but there are some paid ones too. And shout out to my other best friend, Crystal, who put me up on StreamYard because I didn't know anything about StreamYard until a couple days before I did the one in August. So thank you guys so much. I sincerely appreciate it.
Thank you for having me.
Oh, you're welcome. You guys have a good evening. And I do have something for all of you that I will send you. So check your email very soon, probably by the end of the month, because I am still so crazily busy. But by the end of the month, it'll be there. I promise.
Thank you. Shantay, when I come back to Detroit, we have to get together.
Yes, because this is a whole vibe, and I'm like,
thank you guys. Bye, everybody.
Bye.
Bye. Bye. Bye.
Bye. Bye.